Barely before Uganda could make a quarter a century after independence, an almost unstoppable scourge hit the country. A virus which was later titled to be HIV could then quickly cause AIDS. The rampantly spreading disease soon caused a wave of death in the nation, and its epitome of impact was majorly felt around ROHP district, the place the very first victim of the disease was discovered. However, with high levels of illiteracy in the country, the disease was quickly titled voodoo, and the practices of witchcraft to rid the patients simply escalated the problem. However, government and the different stakeholders in the HIV issue have over the years garnished strength to beat this epidemic. With national campaigns to have people test and discover their status, the president was a good example in doing the same.
Testing is in your interest. If you find you are positive, then you start using the ARVs. If you are negative, then you know that you are all right and you avoid risky behavior.
All people must test themselves, but even more so, the leaders must test themselves publicly so that they give reassurance back to the people and they make themselves the role models that the people will follow, so that we can really know that we are preaching what we practice, that we don't tell people that they must protect themselves from catching HIV and AIDS and then go out there and get HIV and AIDS and hide it.
Most of the clients are still living under fear. They don't still want to come for the disclosure. They don't want to disclose the state has fear for HIV testing for those who are not yet tested, so that we should have them tested for HIV.
Nonetheless, the aftermath of the early days can still be felt strongly in different places all over the country. Child-led families are continually spread in ROHP district. Living in squalid shelters, surviving on less than $1 a day, education in cases like these has ceased to be a necessity, but rather a luxury, for they still cannot afford the cheap universal primary education. Others couple poor living conditions with being infected with the virus.
Still experiencing an enormous burden of HIV/AIDS. Data from the Uganda Indicator Survey indicates that the proportion of adults with HIV has increased slightly since the last national population-based survey in 2004-05 from 6.4% to 7.3%.
Despite various efforts, ARVs are not adequate for potential candidates. The helpless elderly are only surviving at the mercy of God. Having gone on a university research project funded by his guardian, Nabagala Annette, Rutaraka Joseph soon found himself caught up in the feeling of wanting to help better the situation of orphans as a result of HIV. After a discussion with Annette, they came up with a project called ROHP Orphanage Hope in the desire to make a difference.
ROHP Orphanage Hope project was started in February 2013 after Christian students carried out research on the impact of HIV/AIDS on the Christian best for children. Rutaraka Joseph was a student sponsored by engineer Nabagala Annette. Later, the student adopted 2 children who were affected with HIV/AIDS. Then the idea was sponsored by the engineer Annette to become a project and started to sponsor those vulnerable children.
As ROHP Orphanage Hope project, our vision is to see hope restored in children with HIV/AIDS.
We have a program of follow-up of the children with the ROHP Orphanage Hope project that they are helping a lot in the follow-up of these children in the villages.
The organization focuses on helping mainly with basic requirements of any living child, with central focus being on education and health.
Our support is mainly in education, healthcare, and water and sanitation.
Rakai Orphans Hope Project goes to the grassroots to offer their services in hope of bettering the lives of people affected by HIV.
Our field office identifies families with children who are affected with AIDS and those who are infected with AIDS and enroll them on the project.
This is Mulans Patrick, one of our child that we identified in the field. He stays in this place. His dad died last year. He just been helped by his auntie. Basically, they are not even aunties, but they are just neighbors, well-wishers.
We have to appreciate the work of Rakai Orphanage Project. They are doing a great work, especially for the children that have been neglected, that are stigmatized. They are doing a great work of doing sensitization, follow-up, and making sure that they reach the health facility for the free medication. So I must thank them for that great job they are doing.
The two main funders and equally volunteers do their best in reaching out to the orphans to offer everything within their means. But considering that the initiative is funded by individuals, they can extend a hand to just a handful of this large helpless community.
So it's our cry, it's our will now to call upon every individual who is willing to be part of this project.
Regardless of how big their mission is, without help, they cannot do the much that is required of them.